Hi, my name is Rachel Shelby. I'm a certified family nurse practitioner. I've been employed with Core Medical Clinic since 2016. I just wanted to review the importance of having a primary care provider. I've been a certified family nurse practitioner since 2010, a registered nurse since 1998, and I serve as a primary care provider in this clinic. And just to review a few statistics, nearly one third of Americans, almost 100 million people, do not have a primary care provider. And speaking specifically to an age group, millennials, who were born between 1982 and 1996, that includes me, 93% of us do not have a primary care provider. That means only 7% are taking care of their health care needs regularly. This statistic is very alarming to me. A primary care provider is very important. We can manage acute care needs like colds, illnesses, injuries. We can also prevent and manage chronic diseases such as diabetes or cardiovascular disease. Primary care providers can also help with mental health disorders, treating anxiety and depression, and managing medications to help manage those problems. I want to address 3 questions surrounding being a primary care provider. First of all, why is it important to me to work in primary care or family care? And just so you know a little bit of background for me, I worked as a registered nurse for a very long time, but I worked with the cardiovascular team at a local hospital. I performed consultations on open heart surgery patients and followed them from the consultation to post-surgery. I followed them to ICU and then the telemetry floor and then even home in their recovery for the next 30 days. I realized that the continuum of care process is very important and that a lot of these patients didn't have a primary care. They didn't have anybody managing their medications or even doing things to help prevent the cardiovascular disease that they were there for. Some of these patients could have avoided open heart surgery with preventative care and education. The second question I would like to address is, why should I even establish a primary care provider? Well, primary care providers are not only doctors or healthcare providers like myself, but they are your healthcare advocates. The healthcare system is very complex and confusing. Don't you want someone who has a little bit of knowledge about the system and how things work? Once you establish a primary care, they get to know you and know your past health history and can help provide a more personalized healthcare plan specific to you. I view my patients as my friends, and wouldn't you rather have a friend with healthcare knowledge to help you through your medical needs than a stranger? That's why it's important to establish a primary care. The third question I would like to review is, what can a primary care provider do for me? So a primary care provider can treat illnesses, acute illnesses such as cold, illness, infections, injuries. We can prevent diseases, catch illness early, manage chronic diseases or conditions, prevent unnecessary ER visits or expensive urgent care visits, connect you to a specialist if needed, save you time and money, and can get to know you best becoming an advocate for your health. So I hope this video was helpful for you and informative on the importance of having a primary care provider. If you don't have a primary care provider, consult with your insurance benefit provider for a list. They can give you one near you. The hardest part is just making the appointment. After that, I have no doubts that the lasting benefits you will receive from establishing a healthcare provider will be well worth it. So good luck to you, and cheers, and here's to staying healthy.